Really
Good.
proud of yourselves. Yeah,
Okay,
that's
we're,
great.
we're live, guys.
Oh, we're live.
Yeah, okay.
Hey, guys. Hello, Winnipeg. Hello, Manitoba. This is Kuya Noel of the Kuya Noel and Tito Aldo Show. And tonight is a Manitoba Liberals night. Last week we had Wab Kinu and Malaya Marcelino. And we want to be fair to every parties here in Manitoba. So so tonight we have the Manitoba Liberal Party caucus headed by the Manitoba Liberal Party leader, Dougal Lamont. Hi, sir.
Hey, how are you? Great to see you.
Good. And
thanks for having us.
Oh, no problem. It's our pleasure. It's our honor. And of course, we have the MLA of River Heights, none other than Dr. John Gerrard. Wave. Hi, Doc.
Hi there. Very nice to be with you. What an opportunity.
Awesome. And of course, last but not the least,
it's an exciting time.
Yes, sir. My MLA, because I live a little bit biased here. I live in Tyndall Park area. My MLA, Cindy Lamoureux, in the house. Woohoo!
Yay! Noel.
Hey. All right. So we are also being joined by our director, although he's not being seen in the screen. His name is Director Aldous Guzman in the house. There you go. He's invisible. All right.
Hey, Aldous.
Yeah, okay.
Diverse Industries, that's our company. Anyway, this is going to be a 30 to 35-minute show, as you all know. And we would like to start off, hearing from the Manitoba Liberals. I would like to fire off with my first question for all of you guys, for the three of you. In general, what do you think of the Pallister's government's response to COVID-19? Starting off with Dr. John Gerrard. Go ahead, sir.
Okay, well, one of the things that I've been very concerned about is the personal care homes. And the Pallister government so far hasn't paid a lot of attention to personal care homes, and we're very concerned. And so if people are seeing problems in personal care homes, they should let us know, because we want to be right on top of them.
All right, personal care home. How about you, Cindy? What do you think of the strategies being done by the Pallister government in response to COVID-19? Go ahead, Matt.
Yeah, in a pandemic such as this, the biggest thing is we need to be getting the awareness of the information that we've gathered in Manitoba out there, out to the public. People in Manitoba deserve to know what's going on in the province. And every day we have tons of questions on Facebook, on Instagram, on Twitter, through our own legislative email accounts. People are unsure if they're supposed to go to work the following day. They're unsure if they have to pay rent. They're unsure if their rent payments are going up. So I think that the Pallister government really needs to start getting the information out there to all Manitobans, so people have a little more certainty.
Yep. And of course, from the leader of Manitoba Liberals, go ahead, Dougal.
Yeah, look, it's been pretty frustrating. I know over a month ago, we put out a call to the government to say, look, you should have a plan in place. We want to make sure that we're protecting seniors, because it's hard for them. If people have to stay home, we want to make sure people can get food to them, that food and medications are delivered. It's been really frustrating because, look, everybody wants to know the right thing to do. And there have been tons of people out there who've been doing great work. They've been volunteering. They've been helping. People in healthcare have been amazing. Early childhood education have been amazing. We really have to thank all those people who've been working so hard. But we haven't seen the kind of leadership and support that we need to see from the Pallister government. Because every single time they try to solve a problem, they seem to create a whole bunch more. And that's what we've been seeing. So every single time they make an announcement, we get flooded with emails from people saying, well, what does this mean? Because we've had, as an example, seniors, people who want to have their prescriptions filled, and all of a sudden they can only do it for 30 days. So they're having to pay multiple fees, people not being able to work, people not sure about what's going to happen with their businesses. And the government has been very reactive. They've been really slow. So up till now, Manitoba is still the only province that has not announced any support at all for workers. and that's a big problem. And this is something that they really need to step up and get ahead of this, because there are two things. One is the health side. We want to make sure everyone's healthy, everyone's safe, and people have been doing a good job of staying home, washing their hands, all that other stuff. But we also have to make sure that people are able to pay their bills throughout this, right? So, and that's been a big gap when this government is concerned.
Thank you, guys. I checked your website and I noticed that your party has several advocacy addressed to the Pallister government, as you started it, Dugaut and John and Cindy. This is to help, of course, the different sectors of the province, right? Can you share with us the highlights of this request and what has been the response of the government, if any?
Yeah. Well, I'll say, we can talk about it. Cindy, if you want to talk about childcare, and John, if you want to talk about some of the other issues. But I know that we've had some things where we've been putting in letters, and there have been little changes. So I'll give an example when it comes to business. We actually said, look, there are shortages or we think there aren't enough masks, there aren't enough gowns and equipment to help keep healthcare workers safe. So we said that the government should help local companies build and make some of those things, so that we're producing masks here, so we're producing gowns and everything else. And they have announced a fund for that in response to what we suggested, which is good. But John, if you want to talk about some of the issues, and Cindy, if you want to talk about childcare and what we've been looking for and how what we haven't heard back.
I think that I want to talk about childcare, but I also want to continue saying what you're talking about, Dougal, with respect to prescription medications. Yep. Before it was actually being discussed at all at a national level or just provincial level here, we were receiving emails from all three of our constituencies from people saying that they can only fill 1 month of prescriptions now, and they have to pay the extra dispensing fee, and they actually have to go in, some of them, to get monthly prescriptions from their doctors, not 3-month prescriptions. And so I believe it was our party who actually brought that forward to the province's attention, and now they're starting to address it, but changes still need to be made. With respect to childcare, again, we were just flooded with emails. I know even my Instagram account, I had daycare workers reaching out to me saying they're not comfortable going into work, and how come they're being left behind, and how come they're not being considered. So we started writing letters and ensuring that the government was actually aware that people were in this situation.
And we've heard some little changes, but there's still not enough. So part of this is to make sure that we just keep up the pressure on the government. Because it's not a big surprise. Look, everyone is working full out on, right now on this, and I'm sure they're overwhelmed as well. But but there are some really urgent issues that need to be addressed, and one is childcare, because childcare centers are being told, well, some of you have to close, but you'll only have so many people. You're only allowed to have so many kids there, and they just don't have the money to actually do it. So we want to make sure, look, the government really has to step up and make sure people are taken care of, especially like if you're working in healthcare, whether you're a nurse, a doctor, anybody else who's in the healthcare system and who's going to be caring for people who have COVID-19, those people, it's absolutely critical that those workers know that their children have a place to go, can be looked after. And the government hasn't done a good enough job of making sure that those childcare spaces are there for essential people to do their work. And John, I know you had a question about testing because there was a situation where there was a worker in Gimli who had tested positive, and you called on the government to make sure that everybody up there was tested.
Can you share that with us, John?
Oh, sure. Yeah, just follow up to what I was talking about earlier on, how critical it is to pay attention to personal care homes and make sure that we're really on top of them, because that's where a lot of the deaths have been in many of the other provinces and indeed around the world. And in Gimli, there was one of the workers there who turned out positive. And the government went in and they've tested just the people who are symptomatic. But it's really so critical that we detect in a personal care home situation, not just those who are symptomatic, but there can be asymptomatic people, and that we are testing everybody there.
Yeah.
So that's what we've called for.
Yeah.
There have been many, many problems that have come up in a lot of the government's announcement. And we have been, I have been flooded, as have Dougal and Cindy, with calls and emails. And we've been daily writing many letters to ministers about this. But it's also, there are issues where we're directly helping. For example, I got a call last week, or Dougal did, and then handed it off to me, from a woman who works at Price Industries. And she said that they were developing a process to make 3D printed masks. And this was very exciting, but they were trying to get through to the government and they'd not been able to get through. So I managed to call Ralph Eichler, who's the minister responsible for economic development, and told him how urgent and important this was. And he was going to call them. And I hear yesterday, actually earlier today, that when Brent Rusin was talking this morning or this afternoon, that he mentioned that there was some 3D printing possibilities. And I think that what that means is that what we've been able to help connect people into the government to make sure that things are getting done.
Yeah.
And sometimes it's working with others. I got another call, email this week. This was from a woman who's with Angela Taylor with Inspire Communications. And she is working with kids in school. And of course, there are quite a number of kids who don't have computers. And she zeroed in on this and said, if we're going to lock the schools and close the schools to kids and expect them to work from home, we've got to make sure they've got computers.
Yep.
And so she sent me an email about this. I gave her a call, and within an hour and a half, I had her lined up to get some computers through Computers for Schools. And in 2 days, she was already had got 100 to 110 computers and was getting them out. And she had many, many more people who she identified who were the critical need because kids didn't have computers. So we're working directly with the government. We're working with nonprofit agencies and people and doing everything we can every day, all day, and to try and get us through and help get us through this COVID-19 pandemic.
Because that's exactly right. I mean, and John, look, I'm incredibly proud of the work that Cindy and John have done. They've been absolutely amazing at representing the people who live not just in Tyndall Park, River Heights, and St. Boniface, where I live, but making sure that people are heard and passing that information up to ministers and making that connection. There are times it's a tough time because look, I don't want to praise the government if they don't deserve it. But this is also a really important time for us to be able to contribute whatever we can and make a positive contribution. And some of that is pointing out to the government, look, what you're doing isn't working, and here's a better solution, or here's a company here in Manitoba who can help solve the problem. Or in this case, we managed to John managed to make a connection where a whole bunch of kids are going to have computers who didn't have them before. So that's part of what, and we just want to be. It's really important to have that voice that's productive, where we'll make the criticism where it's needed, and push the government where it's needed, but also be able to work with them enough that we can make sure that we can get things done, because that's the most important thing right now. There's so many people who are scared and stressed out, and it's a scary time, but there are a ton of people who really want to do the right thing and make sure that we're getting things done and keeping people safe and making sure people can pay their bills. Those are our priorities right now, and it's not limited to just the constituencies that we represent. There are Liberals everywhere across the province, and it doesn't matter whether you voted for us or not. If you're not getting an answer from either of the other parties, get a hold of us, and we'll try to get your questions answered for you and push that issue for you. It's been a really extraordinary time in a lot of ways, but it's also an opportunity to bring out the best in people, and that's what we're hoping to do.
I want to segue to you guys responding to your constituency. So how is it business as usual in your respective constituency offices, and how do you deal with the day-to-day case works in your riding in the face of this pandemic?
Who do you want to go? Cindy?
Well, it's
Who
not
wants to start?
business as usual.
It's not business as usual. Yeah, we
It's,
can all agree.
we're using we are using phones. We are using video conferencing. We're having meetings, video conferencing, and caucus meetings, video conferencing. It's an interesting, exciting time, but it's very different from usual.
Yes.
Yeah, everything is done through email and social media. The amount, like the volume, the density of emails and questions through Facebook and Instagram have gone up tenfold for me. Like I will easily spend 3-4 hours a day just responding to emails. And a lot of the emails are just helping navigate systems. We're talking about how to apply for CERB. We're talking about how to apply for EI. People have questions on if they're eligible for certain programs. I know I have 5 wonderful, wonderful staff. Many of you guys know them. I have to do a shout out because they all live in the constituency of Tyndall Park, but to Robert, Trinidad, and Francis, and everyone knows Leo and Carl and Ate Adele and Crab, and they're wonderful. They're working hard every day from home. We're staying connected through Zoom. They're answering phone calls. If you guys have questions here in Tyndall Park specifically, but all over Manitoba, as our leader DeGold said, don't hesitate to reach out to our offices. We're doing the best that we can.
Yeah. And for me in St. Boniface, we're not taking in-person meetings. But one of the things we did just before the legislature shut down is I sent out a card to every single constituent to say with three kinds of contact information. One was that there's a federal government website, which is canada.ca/coronavirus. That's where people can get all sorts of information about travel. They can get information about applying for EI and special benefits. There's the Health Links phone number through Manitoba, as well as the Manitoba website. I don't want to get them wrong, so I won't say what they are. But also, people can contact my office, and it's all sorts of stuff. It's small businesses who are worried about supports, and there are some supports for small business through the federal government, but the Pallister government has really dropped the ball so far. What they've proposed is not going to be enough. I mean, there's just no doubt. They've announced a bunch of sort of tax cuts, but those tax cuts, frankly, the first thing is that the more money you make, the more taxes you'll save. So this is really going to help out a bunch of really big businesses that might not need the help, first of all. It's not targeted to the people who really need it. But the other is that it's so important we want to make sure that once we're through this, that the economy can bounce back, that businesses and families, you can go back to your job, that there's a job there for you to go back to. And I don't think that the Pallister government has done what it takes yet. The federal government, to their credit, has done a lot of really good stuff. They're proposing a 75% wage subsidy. They're proposing some other help for individuals who are laid off. But the Pallister government they really have got to step up their game because I don't think businesses should be going bankrupt because of this, and people should be able to pay their rent and pay their bills throughout it. This I don't know when there's ever been a crisis like this in decades. So it takes really exceptional action. Like to actually deal with this, we're going to have to do some really big, bold things. And that's something the Pallister government has to come to grips with, because otherwise there are going to be businesses going under who shouldn't be going under. Right? That's one of the most important things, and that's true all across Manitoba, especially young entrepreneurs and young people who've put their money into a business and they'll lose it, and that shouldn't be happening. Period. And we feel very, very strongly about this. Is that there's two things. One is health. But the other is, look, people have got to be able to look after their families, and we've offered all sorts of suggestions to make sure that does happen. Well, we hope that the government will change its tune, but we're also going to continue to if the provincial government won't do it, we're going to call on the feds, because I think the feds are reasonable and they're willing to do what it takes, and we're hoping that they'll step up if the Pallister government doesn't.
This is my favorite question for you guys. How do you connect the impact of COVID-19 with the cuts, or should I say, the changes that have been made by the present government, our health system? Would like to answer first?
Is John there? Does someone want to take that?
Well, let me
John?
comment as our
Those are health critics, so yes.
Yeah, sure. All right. We're very concerned about whether we're going to have the capacity to deal with this COVID-19 pandemic, because there have been so many cutbacks, and we are short of nurses, we are short of doctors in some areas, and it's a potential really big problem, just the way the cutbacks were orchestrated and the impacts that they're having right now. One of the things that's for sure happened is that it's created a lot of uncertainty. And that is what we don't need at this particular juncture, is that people feeling anxious and uncertain. We saw some of the problems right away when they started opening up the access centers. That we had an access center, for example, in Fort Garry, which was the first one open. And there were large numbers of people who came there. They were waiting up to 6 hours. They were sitting close together, which is not what we want with a COVID-19 pandemic going on. They did have masks, which was good. And we're very concerned that because that wasn't handled as well as it could have been, that there could have been more spread of the virus than we want. But we are watching now very carefully, because there's big concerns. Are we going to have enough people to work intensive care units? Are we going to have enough space? We had an incident at the Health Sciences Center in the last 48 hours in which there was a patient who had been in the intensive care unit, we think, for some time, and clearly had got the COVID-19 infection from one of the staff. It was a very dangerous environment, and there's about 100 people, nurses, security people, aides, and so on, who have had to self-isolate as a result of this. And when you take 100 people out of an organization like the Health Sciences Center, you have a significant impact. And so it's not like a normal situation that just having just enough people or just enough space or just enough equipment, that doesn't cut it for this. We've got to have extra capacity and significant extra capacity. And we're really concerned that that's actually going to be there.
That is a big worry, because we were hearing, look, we've been clear about this, that we should be spending more money on healthcare. There's no reason for cuts right now, because the federal government has increased funding to Manitoba by, I think right now this year, it's over $1 billion in the last 4 years. Healthcare funding is going up. Funding for everything has been going up every single year. But for the last 4 years, the PCs have frozen healthcare. They've frozen education. And I talked with somebody who works in healthcare who said, look, what they seem to be doing is they seem to be cutting as hard as they can, or they'll even cut, and then they say, okay, well, we've cut too far. Let's hire some people back. And that's no way to treat the healthcare system. And now we're seeing that right now. We heard back in January from nurses saying there's no room for, they called surge capacity, right? There's no room for extras. There's no room if all of a sudden we have a bunch of new patients coming in, the system can't handle it. And that was in January. So now we're seeing that. And just this week, the government announced that they're trying to bring nurses back in. The measures they're taking are good. And that they're saying, well, we'll pay for nurses' registration fees. We'll wait, they're sort of letting retired nurses back in. But the fact is, they hurt the system by cutting too deep in the first place. So this really tells me it's very frustrating in all sorts of ways, but the entire conservative philosophy has been that there's too much fat and we have to cut back and everything has to be lean. Well, in a system where people are relying on a healthcare system to save their life, save their health, or save the life or health of a loved one, you don't mess with that, right? You have to make sure that that workers can work safely, that they're properly paid, they get the rest they need in order to be able to give the best possible care. And for us, healthcare, it's not a cost; it's an investment. It's something that there's a even the premier used to say that. He used to say, some things don't cost, they pay, and that's true of healthcare. Because if we have people who are healthy, you save someone's life, it means they can go back to work, right? They can go back to work and support their family. And it's why our healthcare system is so important, and supporting workers is so important to make sure that that people get the care they need. The premier is asking for a whole bunch more money, but he keeps asking money for healthcare, but he's not putting it in. So it's long past time that he puts his money where his mouth is and actually invests in healthcare.
Thank you very much. We have 3 minutes to go. Before we end the show, I would like to ask this last question. You have 1 minute for each one. What is your message to all Manitobans as we work together to win this battle of the unknown? Starting off with Cindy. Go ahead, ma'am.
Thanks, Ito. I think that the best thing that we can be doing is taking everyone into consideration. Do practice social distancing. It's not just about you, it's about the people around you too. We know that it's carried within the air around us as well. So if you're walking down a sidewalk, even if you're perfectly healthy, maybe you're walking by someone who is more vulnerable to the sickness. Be considerate of other people. Stay home as much as possible. All the small things like washing your hands. Practice this. I've seen lots of videos all over social media of doing like the spiders with your hands. Do everything you can. Have some fun with it. Take care of yourself mentally as well. Take up a new hobby. I started sewing. Take something up. Do something fun. Spend some time with your family as much as possible. Try and keep a good attitude, and we'll keep you informed as we go.
Yeah. Go ahead, John. You got 1 minute. John.
Okay, I just want people to know that we have 3 Liberal MLAs. We have a very strong Liberal team who's working very, very hard. 4 people trying to do everything we can, and we are going to be with people all over Manitoba just doing the best we can to get us through this difficult time and hopefully out the other side in good shape.
Awesome. Go ahead, Dougal.
Well, look, the most important thing is stay home, stay safe. This is a scary time, but people really do have the power to make a difference. Is that by staying home, by staying safe, by practicing all those things, you can keep your family safe, and you can help. This is something that people need to understand. They have a power. They really do have a power to make a difference. And the other is speak up. Let people know. That's one of the most important things, because it's how we find out what's going wrong. It's about how the government finds out what's going wrong. So don't be afraid to speak up. Don't be afraid, because people need to know if things aren't working. That's the most important thing you can do. So, look, it's not going to be easy. It is, like I say, it's scary, but it's okay to be scared. But we're all in this together, and I think we have, ultimately, we'll come through this stronger than we were before.
Awesome. Thank you very much. Manitoba Liberals, ladies and gentlemen, here at the Kuya Noel and Tito Aldo show. So I hope to interview you guys again. We'll set another interview with you as maybe an hour instead of 30 minutes. And thank you very much for allowing us to guest in our program.
Thank you so much.
Yeah, it's an honor, guys. And all the best to you. All the best to Manitoba Liberals. And to all of our viewers, maraming salamat po. This is Kuya Noel of the Kuya Noel and Tito Aldo's show. Good night.
Thank you.
Mabuhay.